Amber Elliott now. She's the St. Francis County Health Director. Amber was quoted in the Washington Post about the uncontrolled spread of the virus in Missouri. She says she's been threatened for trying to talk about science and facts. To the Post, she said, "I've been living with that steady hum of tension and fear for almost a year, and I just can't do it anymore. I keep saying my family's my #1 priority, so at some point I have to keep my kids safe. I decided to put in my notice earlier this month. My last day is this Friday, tomorrow. You had to quit."
Yeah, I think it really comes down to the safety of my children, and
you felt like they were in danger.
Yeah, I did. I mean,
Why?
we had someone take a picture of us at a ball game, and it included my daughter, and I think that was the turning point for me after putting up with quite a lot of things over the last 8 months. I think that was the tipping point.
You said the more you talk about the facts, the more it seems to put a target on your back. If people at your level are being threatened for just telling the truth, how concerned are you for the rest of frontline workers, our heroes everywhere?
Absolutely. And I think we're seeing it. Our healthcare workers are exhausted, and they are shouldering the bulk of this pandemic and really working on the front lines to actively save lives. And, people still, we've heard the stories of people, they're still not believing that this pandemic is real.
So tomorrow's your last day on the job. And sometimes it feels like we lose sight of first responders on all levels fighting this virus because it's so overwhelming. How big of a burden is this to fight? And what does it take for people who are trying to help and need to quit for their own safety? I just wonder how it comes to this.
Yeah, it's a huge burden because, I think even, my staff, this has intersected all of their lives. And, we have a small staff, the county is about 67,000 people. And so, my staff's like 23 people, and we have worked around the clock for 8 months. And, it's just not sustainable. And then you couple that with, a lot of the backlash in the community when you're literally just trying to help and prevent the surge that we're seeing now in Missouri to the hospital system. Yeah. And, it makes it a lot harder. It's
a hard story for us to tell because it's not like a fire where we can show a building burning. We can't show the inside of the hospital. And I wonder if you could, for our viewers, some of whom are probably going, they're blowing this out of proportion. If you could paint a picture for us of what it's like.
Obviously, I am not working in the hospital. I'm directing a health department, but we work closely with our hospital system. But, you have to always think about that the hospital is something that we think is always going to be there. And, right now, across Missouri, we're seeing the surge of patients. And I think they've been very vocal in St. Louis about talking about what the surge is looking like there and that they are at capacity. And we've had a lot of difficulty, transferring patients and making sure that, we've got a place that we can care for people. And, at the heart of it, that's what healthcare workers want. We want to be able to serve our public, our citizens, and we want to be able to serve them safely. And, that means safety for us. That means, safe patient ratios for them. And so, I think it's a really big concern right now.
Shepard Smith here. Thanks for watching CNBC on YouTube.